Hi pregnant moms, this is Dr. Burke-Galloway, author of The Smart Mother's Guide to a Better Pregnancy, blogger and OBGYN physician. So today I want to share an experience with you that hopefully will help some pregnant women. I get a phone call from a reporter in New York, and she is affiliated with HollywoodLife.com. And she asked me some questions about preeclampsia based on a story, a TV show that was very popular in Britain called Downton Abbey and has now become popular here in the States. And so the question is, I guess one of the characters, Sybil Crawley, a woman who was in the TV show, very nice, and she was pregnant, and unfortunately she dies because she had a very arrogant physician who didn't pay attention to some of her complaints, such as a headache and feeling, quote, foggy. So the reporter asked me, is preeclampsia something that happens in the olden days, or is it something that happens now where women can die? And unfortunately the answer is women still die in the 21st century because of preeclampsia and eclamptic seizures. So preeclampsia is a condition that occurs in pregnancy, usually after 20 weeks. And when we hear about preeclampsia, we usually think that all three things are happening at the same time: blurry vision, headaches, and swollen feet. But the issue is these conditions don't have to happen all at once. A woman can have high blood pressure, or she can have a puffy face, or she can have a weight gain of like 5 or 6 pounds in 1 week. And each one of those conditions is suspicious for preeclampsia. Let me give you a brief example. There was a woman who had a normal blood pressure of 110/60, and then when she turned 37 weeks, her blood pressure was 130/84. Now that might not sound like it's high, but for her it is high because it started low when she first presented to her doctor, and at the end of her pregnancy it's high. Now, it's not that magic number of 140/90 where people start to get nervous when, you know, at that point you say, oh, okay, well, you are preeclamptic. So the woman's blood pressure was what we would call borderline. She calls her physician, which is something she should have done. Her physician is not there, and she speaks to someone who's covering him. When she discusses her problem, he basically blows her off. He says, oh, you're okay. You know, your blood pressure is a little high, but just, you know, maintain bed rest and you should be fine. And that is the wrong answer to tell her, because if you don't know, if he didn't know what her condition was, he should have at least told her to go to the hospital to be checked, and he didn't. And this is why women end up, unfortunately, in our country dying, because by the time people really jump on the patient in terms of managing her properly, it's too late. So, Sybil Crawley, the fictional character, imitates real life. And if her fictional death raises awareness about preeclampsia in our country, then her death, albeit fictional, was not in vain. Because if the media is now involved and expressing an interest in preeclampsia, then maybe, just maybe, my OB colleagues will do a better job of advising patients about the warning signs of preeclampsia, so that when someone is confronted with that condition, the patient will know what to do, which is go to the hospital. Even if someone tells her she's okay, if she feels in her heart that something's wrong, she will go to the hospital, and our physicians will do a better job of managing this condition. This is Dr. Burke-Galloway. As always, it's been my pleasure to talk to you. If you have any questions about your pregnancy, please hit me at www.smartmothersguide.com. I'd be more than happy to share my expertise with you so that you can have a healthy baby.